Thank you so much, everyone, for joining us here today. As I said, I'm Heather White with the American Foundation for Suicide Prevention, and joining us as we prepare to learn more about how we can save lives through public policy and arm ourselves with the information that we need to meet with our representatives, share our stories, and ask them for their support. So a little bit about today's agenda. We're going to have some welcoming remarks from folks. We'll go over a little bit of our legislative priorities, ways that you can start taking action, some things that you can leave here doing today. We'll have a brief question and answer session for folks who need some more clarification. And then for anyone who's new to the advocacy world or to meeting with your legislators for the first time, our volunteer Karen Carrera, who is a board member with us, will be walking us through our Advocacy 101 program at the conclusion of today. So first, I'd like to welcome Jennifer Kelliher. She is the Managing Director of the Massachusetts Coalition for Suicide Prevention to share some words with us today.
Thank you, Heather. So I want to welcome everyone to our 6th annual and second virtual MCSP and AFSP Speak Up to Save Lives Advocacy Day event. I want to thank you all for taking time out of your day to participate in this really important effort. We're aware that we spent all last year dealing with unprecedented circumstances that none of us ever expected, and that during this time, mental health and suicide prevention have been more important than ever. Social isolation, health anxiety, racism, and economic insecurity are always potential risk factors for suicide. But in the last 12 months, each of these factors have been immeasurably amplified, and our member organizations have been working tirelessly to provide as many resources and as much support to communities across the state as they can. We all know that mental health and suicide prevention are always critical, and that suicide prevention efforts save lives. But it's never been more important to make sure that our voices are heard in order to maintain these essential services in our communities. And this is something that the legislature has recognized when they funded our line item for FY21 at $6.7 million. And that was an increase of $1.7 million, or 35%. And actually, that was the second largest increase we've seen in the history of the line item. This event is representative of the extensive collaboration in suicide prevention across the state, with a planning committee comprised of individuals from AFSP and MCSP and participation from many of our member organizations. I want to thank everyone in the planning committee, especially our advocacy chair, Heather White, for all that you've done to make our second virtual event possible and make sure that we'd still be able to have an Advocacy Day event again this year to enable us to have our voices heard. Each year, this event highlights the importance of suicide prevention in Massachusetts, and it's a testament to the dedication of and strong collaboration between community members, service providers, survivors of suicide loss and attempt survivors, impacted family and friends, and other stakeholders. Our strength in advocacy as a state and as a coalition comes from the fact that we are truly statewide, and we represent the interests of communities across Massachusetts, from the Berkshires to the Cape and everywhere in between. The MCSP has 10 regional coalitions that cover the entire state, and most of those coalitions are represented here today. Because of this unique strength in our advocacy efforts, because suicide is an issue that impacts every demographic in every community, and most importantly, because of the tremendous support of our legislature, Massachusetts is actually one of the highest funded states per capita in suicide prevention in the entire country. And I believe it's because of this that we also have one of the lowest suicide rates in the United States. We rank 47th out of 50 states in DC in the suicide rate. And this is not only a credit to our legislature for the resources that they so generously provide, but also to the wide array of prevention, intervention, and post-vention services that are available across the state. And it also speaks to the unified mission and purpose of all of us here today who are doing this work. We're all here to reduce suicide. We're all here to save lives. But for this work and these collaborations to continue, it's essential that legislators hear from their constituents about the impact of suicide in their communities and individuals that they represent. And it's equally important that they continue to hear how the services funded through the line item benefit their communities, so they can truly understand the importance of maintaining consistent service delivery that will continue to ensure individuals and communities can be reached and lives can be saved. Today, you'll be hearing from speakers who will help you prepare for these conversations, and you'll all be provided with virtual packets both for yourselves and for your legislators or legislative aides. I want to thank you for using your voices, your stories, and your experiences to humanize this issue, and for helping to hold the memory and stories of all of those people in Massachusetts who have died by suicide, who have survived attempts, who have been left behind, and who continue to struggle. In sharing your stories today, I have no doubt that your voices will in fact save lives.
Great, thank you so much, Jennifer. It's now my honor to welcome Nancy Farrell. Nancy is a longtime member of the Massachusetts chapter of AFSP's board and also the chair of the advocacy committee here, not only here in Massachusetts, but also at the national level as well. Nancy, could you please join us?
Thank you, Heather, and thanks to Jen for introducing the issues of the day and to our committee members and AFSP staff who have worked hard to organize this event. Legislators face challenges each year when crafting a budget. There are many worthy issues to address, and it's our goal today to ensure that they understand the value and importance of directing funds to mental health and suicide prevention programs. Our work is essential, as Jen has said, to continuing to approve and expand programs across the Commonwealth in every city and town. Our budget ask is to direct $7 million to these programs, about $1 per citizen. And directing attention to funding the 988 program is another way to solidify support for our lifeline calls and staffing going forward. And we will, going forward, also be considering other legislation that may come forward. But at this point, we're focusing on the budget because that's the time to do it. Your stories are so important, as Jen has noted. Legislators have families and friends also, and they understand and have experienced these challenges. You will hear today from legislators who know well that the support we are asking for is essential to reducing suicide. They want to hear from us and work to reduce suicide and direct resources to those with lived experience. Just a few words about AFSP. We have an advocacy program and day and State House Day like this one in every state. We also have an office in Washington, D.C. that was a leader in passing the legislation to establish the 988 line, supported by chapters and individuals throughout the country and in Massachusetts. You can join us on a regular basis in sharing your thoughts both locally and in Washington by joining us as a field advocate. When there is an issue in Massachusetts or nationally, our team drafts an email that you can personalize and send to your senator and representatives. You can just go to afsp.org/advocacy, and we're going to put the direct link right in the chat. And it only takes a couple of minutes to review and agree to send the advocacy information. We do the work so you can share your support. Right now, we have about 35,000 advocates across the country, and our goal is to get to 100,000. We have a robust number in Massachusetts, so thank you for everyone who participates. We are a growing national movement that is making a difference, and there is some good news. The CDC data for 2020 show that deaths by suicide declined by 5.6% between 2019 and 2020 for the first time in many years. We are hopeful that protective mental health measures, such as the kind we're advocating for today, will continue to have a positive impact at a time of collective distress that we have experienced over the last year. It's difficult now to assess what kind of effect COVID-19 will have on this data, but we also know people are dealing with depression, anxiety, and suicidal ideation by calling hotlines and talking openly about the challenges they and their families are dealing with. We also need to address the stressors and impacts on minority and low-income populations. Your participation today and your follow-up, and that's the most important part of this conversation, with legislators and staff are essential elements in our state suicide prevention program. Please ask your family and friends to join you, send them the packets, ask them to send them on as well. Thank you, and let us know if you need help or have questions. Thank you for speaking up to save lives, and take good care of yourself in the meantime. I now have the honor of introducing Senator Joan Lovely. She is in her 4th term as a state senator for the 2nd Essex District, which is comprised of Beverly, Danvers, Peabody, Salem, and Topsfield. Senator Lovely is, I've just lost my notes. Hold on a second. She and her staff have been terrific to work with. And I'd like to tell you a little bit about her. She has a law degree and served on the City of Salem City Council for 15 years. She has a number of positions in the Senate, including Assistant Majority Leader, Chair of the Senate and Joint Committee on Rules, and Vice Chair of the Joint Committee on Education. She is now a member of the Senate Committee on Reimagining Massachusetts Post-Pandemic Resiliency, which sounds like a really great committee. She's the proud parent of 3 adult children and resides in Salem with her husband, Stephen. She also enjoys her 3 Labrador retrievers, 2 chickens, 4 ducks, and 1 cat. So I know how she keeps herself healthy and happy. I have worked with Senator Lovely and her staff. They've been really supportive of our mental health and suicide prevention efforts. So please join me in listening to her closely and looking forward to working with her in the months to come.
Hello, I'm Joan Lovely, State Senator for the 2nd Essex District. Thank you to the Massachusetts Coalition for Suicide Prevention and the American Foundation for hosting me today. Today's Advocacy Day is one of the most important of the year. As we know, suicide prevention and destigmatizing mental health is of the utmost importance, and it has never been more important than it is right now. Throughout the past year, all of us have been faced with challenges we never thought possible. Many of us have been severely isolated by the pandemic, and the last year has been especially difficult for those already struggling with their own mental health. It is of vital importance that those struggling with mental health and having suicidal thoughts get immediate help. Without the face-to-face contact that so many of us have relied on, people may feel that they don't have anywhere to turn. And that is why these programs are so incredibly important. They are a lifeline for people who may not think they have anyone to talk to. I know that many of you have stories to share with your legislators on why suicide prevention programs are important to you. As a legislator, it's incredibly important for me to hear these stories and to understand how the funding we provide to these programs impacts everyone. I know there are so many people out there who have experienced severe mental health issues, and I know that it can be very hard to talk about, but we must continue to talk about it. Mental health cannot be an invisible epidemic. The more we talk about mental health and normalize it the same way as our physical health, the more people will reach out when they are struggling. Just because you cannot see pain does not mean it isn't there. I wish we could gather in person to listen and learn from one another today. But until we can, I hope you all take the time you need during this difficult period to take care of yourselves. Take the time you need to tend to your own mental health needs. Take a walk, play with a dog, have an extra session with your therapist. We all need some extra taking care of right now. So thank you for all of you for being here today. Your advocacy is incredibly important. Hello.
Those were great messages from the senator, and I loved her calling out some self-care that we can all do. I can't wait to hear more about the post-pandemic resiliency committee that she's going to be on. And speaking of which, we have with us now Lee Watroba. She is the immediate past president of the Berkshire County for Suicide Prevention and a longtime AFSP board member. She's going to share some thoughts with us on where we are with mental health and suicide prevention 1 year later. You know, last year was the first time we did a virtual event. I'm hoping this is the last year we do a fully virtual event. We had some wonderful remarks about mental health during COVID, and now it's time to start looking forward to how we emerge after this. So I'd like to invite Lee to join us.
Thank you, Heather. On behalf of Dr. Christine Yu Moutier, Chief Medical Officer for the American Foundation for Suicide Prevention, I'm honored to share her thoughts and comments with you today. March 2021 marked the 1 year anniversary of the COVID-19 pandemic in the US. Earlier this month, the CDC published data on suicide deaths for the year 2020. According to the new data, deaths by suicide declined from 47,511 to 44,834, a 5.6% decrease between 2019 and 2020. Suicide has reportedly decreased from being the 10th to the 11th leading cause of death as COVID-19 became the third. For the Commonwealth, reports suggest that suicide rates in Massachusetts from March to May of 2020 were in line with the expected range based on recent years' trends. While the data is encouraging, it's imperative that we do not let up on addressing suicide risk factors or implementing evidence-based suicide prevention strategies. While we don't know the exact contributors to the reported decline in suicides, research shows that having open, honest dialogue about mental health, implementing practices that reduce suicide risk in clinical and community settings, and seeking help early and when indicated can reduce suicide deaths. Suicide is not a simple issue to solve, nor one in which there's a one-size-fits-all approach. We can all play a role in preventing suicide. By taking care of our mental health, educating one another on mental health and suicide, and providing resources for all communities, we can make a difference. Health disparities have been prevalent for decades and have been exacerbated by COVID-19, particularly when it comes to mental health in medically underserved communities. LGBTQ, American Indian, Alaska Native, Black, Latinx, and other communities continue to face elevated suicide risk and longstanding cultural and socioeconomic barriers such as limited access to mental health care or limited information about how to access resources and get help. These disparities cannot continue. It's incumbent on political leaders and the medical community to take the necessary steps to create a system that's equitable for everyone. At AFSP, we are committed to building partnerships and implementing programs designed to address these challenges, accelerating suicide research related to underrepresented racial and ethnic groups, and elevating voices in our field that represent diverse communities. The public health crisis of COVID-19 has been incredibly trying from both a physical and mental health perspective. However, I'm deeply encouraged by the way people have come together within their communities to support one another, the increasingly open dialogue among friends and family, in the media, and within workplaces regarding mental health, and the prevalence of telemedicine and other tools that make mental health resources more accessible than ever. After vaccines are distributed and the pandemic dissipates, we must remember the lessons learned about mental health during this time and continue work to protect mental health and prevent suicide. The COVID-19 pandemic and its lasting effect on our nation's mental health is far from over. By mobilizing institutions and advocates like you to embrace stronger evidence-based suicide prevention practices and research, we can help implement suicide prevention policy, increase open-mindedness about mental health, and save lives.
Thank you so much, Lee. I appreciate that. So the next portion of our day today, we're going to talk about making a connection with our state legislators, with their staff, and how we're going to go about not only sharing our personal stories, but also really the nuts and bolts of some public policy and budgetary things that we're asking our legislators to get behind. But one of the key things, and you'll hear this very often, is sharing our personal stories and how much our representatives want to hear our story and why this is impactful for us. So one of the things we always focus on at AFSP and the coalition as well is what we call safe messaging, making sure we're speaking up about suicide safely and that we are sharing our stories safely. So at this time, I'd like to introduce you to Jessica. She is our area director for AFSP Massachusetts. She's going to talk to us a little bit about what safe messaging is, how to share your story safely, and talk about a document that you'll be receiving in your packet that will help you in this as well. Jess?
Thank you, Heather. Am I on?
Yeah.
Okay, perfect. Can't see myself. I just want to take a moment to thank everybody for being here today. I know it's not always easy to carve out an hour, 90 minutes of your day and jump on a virtual event. But again, thank you for being here, because really without you, advocating for suicide prevention would not be possible. So I want to take a moment to acknowledge, as Heather said, the importance of the words we use when talking about suicide. Words matter when talking about suicide and also when sharing your own story. And we want to make sure that you have the tools to do that safely and the language that matches our guidelines for safe messaging. This chart in front of you highlights some of the common do's and don'ts when it comes to language. So please take a moment to read over the chart. One of the most important things is that we avoid using the term committed suicide. Instead, we encourage you to say died by suicide, or ended his or her life, or killed himself or herself. We also want to avoid saying things such as failed or unsuccessful attempt. Instead, we can just refer to it as a suicide attempt or a death by suicide. And more importantly, we want you to encourage to just be polite and courteous. You know, many times with the individuals you meet, they won't know about these safe messaging guidelines. So it's our opportunity to educate them in a polite and courteous way. And if you don't know the answer, that's okay. Even those of us that have been doing this for many years, we don't always know the answer. And it's perfectly fine to say, you know what, I'm not sure, but let me take your contact information and follow up with you. And always thank the legislator for their time. You know, as a constituent, it's really important that you know that you are essentially the star of the show. The people that you meet with, they want to know how the the issue has impacted you and why it is important to you. So this is your opportunity to tell your story. We'll give you a million talking points about current legislation and every bill number or line item in the budget, but ultimately it is your story the legislator wants to hear. So as a follow-up, we'll be providing some guidelines about speaking out about suicide, some reminders of the safe messaging we can use. We will also give you a template to provide your own story, and we call this a vignette. You'll see on the screen, this is my vignette. I became involved with AFSP in 2009 after losing my dad to suicide in 2008. And this is the story that I leave behind with the legislators when I meet with them. So not only they have a reminder of who's coming from their community, but that they can continue to share my story as well.
Great. Thank you so much, Jess, for sharing your personal story and your personal vignette. You know, everyone will have this. You can put a picture of a loved one, share your story. And I know it's not always easy, but it's important to learn how to start sharing our stories and doing so safely. Thank you, Jess. So as Jess mentioned, it's really important to start building that relationship with our legislators. And we want to do this on a year-round basis. It's awfully easy to just come at your legislator once a year when you want to talk about budget line items. But it's so much more impactful if we can have a relationship with our legislators year round. And how can we start building that relationship with them, that we feel comfortable coming to them, but also that they know they can come to you. We want you to start building yourself as a resource for them. So when they have a question, when there's legislation they want clarity on, they know that, oh, I have a constituent that works in suicide prevention or volunteers her time for suicide prevention, and they know they can come to you. So we can do that through a barrage of emails or handwritten letters, phone calls, meeting them in person once the COVID restrictions are lightened. And as Jess said, there are three really easy steps: introducing yourself, sharing your connection to the cause, offering to be a resource, and as Nancy said, that ever important follow through and follow up when you say you will. But we have a very unique opportunity with us here today. I am excited that we have Elena Cohen with us. She is the district director for Senator Joe Comerford. Elena, I just want to make sure you are unmuted and can sign in. It's not often that we have a staffer with us, and I'm so glad that we do, because very often when we schedule a meeting with a legislator, we end up speaking with their staff. I don't even want to say instead. You know, sometimes we go, oh, I couldn't get a meeting with the senator. I only got their staff. And we always say, no, that's great. You want to have an opportunity to meet with the staff. So we're delighted to have Elena here with us today to tell us a little bit more about her role and how the staff plays a key part of this relationship that we're trying to build. Good morning, Elena. Are you here with us?
Hi, yes, I am. Can you hear me okay?
Yes.
Great.
Thank you. Do you want to just take a moment to introduce yourself? Tell us a little bit about what you do as a district director.
Sure. Well, thank you so much for having me. It's really a pleasure to join you all today. I just really, advocates are so important, and I know I speak for all legislative offices just when I say that. We're so grateful for all of your work. So our district is 24 cities and towns in Western Massachusetts, and I work out in the district. So I'm not in the State House, but I meet with constituents in our district office when we have a physical office open. We're all working remotely at the moment. And I do a lot of work both with our municipalities and with individual constituents. And really every member of our team fields calls and questions about legislation. I'm not deeply involved in our legislative work, but I'm very familiar with the process and can always get answers for constituents if I don't know the answer right away. And we have 5 staff members in our office, and all of us are in very frequent contact with the senator herself. So really, if you if you talk to me, I can relay a message to her immediately. And I do think it's important to sort of understand that staff are sort of the eyes and ears for the legislator. So we convey everything we hear directly to our bosses.
Elena, can you talk to us a little bit more about how the staff could help their constituents build a relationship ongoing or sort of year round with their local legislators?
Absolutely. I think that I hold office hours in the district, again, under non-COVID circumstances, and people frequently, advocates will come and meet with me and speak about their priorities, throughout the year. I have relationships with people that, they email me regularly with updates on an issue they care about. And really, we remember those connections. I think it's exactly what both Jessica was saying about the personal stories. They're very impactful. I think I hear Joe, the senator I work for, speak frequently about particular stories that people told her, and she remembers them. And so do all of us as staff. And I think if I hear something that really moves me, or I think she needs to hear directly, I'll connect her with a constituent and make sure that she hears that same story. We're always happy to. Legislators, speak frequently at events. If there's ever a fundraiser that someone is doing for a cause that a legislator cares about, or you want them to become a stronger advocate for, she gets invited to speak frequently at those kinds of events. And I think exactly what Heather was just saying. It's sort of an ongoing relationship. It's a win-win for us, as well as for you, because I think that people approach our office about really any issue under the sun, and there's no way that we could be experts on every issue. So having resources in our constituents to say, I don't really understand this question about suicide prevention that I just got. I remember Heather is a resource. I could reach out to Heather. That's very, very helpful for us. So it's a partnership.
Great, thank you. Elena, could you tell us a little bit about what you or your staff look for when you're meeting with a constituent? What kind of thing you want them to bring with them, what you're hoping to get out of a meeting with a constituent?
Sure. I think it's always great if you're advocating for a particular piece of legislation with your legislator. It's great if you can do a little research beforehand on, is this an issue that my legislator already cares about? Have they already worked on a related issue? Sometimes people will approach us and say, I'd really like Joe Comerford to co-sponsor this piece of legislation. And we've actually already co-sponsored it. She's actually already signed on. We can, we field those calls all the time, and it's not, we know how much work it is to sort of track legislation. But if you've already done that research, it's always sort of makes you look that much more prepared. And I think that's helpful. And really, like has been said already, personal stories are some of the most powerful advocacy. And I'll just add one more thing, which is that I think the legislative process is a fairly complex and opaque process. And so I never expect constituents to know the ins and outs of exactly where a piece of legislation is in the process. And I am more than happy to explain to people how to navigate the MA legislature website, or sort of, try to make things a little more transparent, because really it's not where I would like it to be or where our office would like it to be.
That's great. Thank you so much. And thank you for being here today, Elena. That is a perfect segue to introduce Marty. Marty Anastasia is our legislative advocate, and he'll be going into some more of the specifics of our ask to our legislators in terms of the budget. And then there's one piece of crucial legislation in need of support around the implementation of the 988 Lifeline. Feel free, if you would like, if you're a note taker, to take notes, but also remember that you will be receiving all of this as soon as this Zoom is over. You'll be getting all of the material that we're discussing today. And now we do know that there are many other bills and opportunities available. Really too many bills to be highlighted at just one time. But we have lots of many other outlets available to all of you to support other legislation as it moves through the process and is vetted by our partner organizations. So please keep in contact with us. We will be sending updates about other pieces of legislation that you can support, and we'll be sending out action items, many more to come. So for today, let's go to Marty. Thank you for being here today, Marty, and you can lead us through our two primary asks for today.
Sure, and thank you, Heather. And just to follow up to Elena's points, I can, as being a former staff member in the Senate, both for the Majority Leader and in Senate Ways and Means, I can attest that sometimes it's just as important to talk to staff as it is to the elected official. Staff will be in the room when the senator or the representative ultimately makes a decision, whether it's on a budget line item or a public policy issue. So having that type of resource at your disposal and talking to them, having them in the room with the elected official is just as important as talking to the senator or the representative themselves. So never be discouraged if you're meeting with staff. Sometimes it's probably more important, but I'm not that objective on that case. So going into our two main items, one is a budgetary, obviously, and the other one would be a policy. The first, we're going to talk about the budget. Last year, through the tireless effort of many people on this call and some other folks not on the call, the public health suicide prevention line item witnessed an unprecedented 35% increase in the bottom line. Now, it's important to note that this was in a year that the legislature had to make some difficult decisions and some painful cuts. But one area they did recognize they needed to invest in was suicide prevention. Obviously, this came in a very important time. The onset of the pandemic led to an increase in calls at crisis centers across the Commonwealth. So maintaining a certain level of services was no longer priority number one. Expansion and strengthening the public health infrastructure to meet these needs became our ultimate goal. Fortunately, we did have the ears of some compassionate and willing partners within the legislature and saw the bottom line for DPH line item increase to $6.725 million. Now, the budget process begins again tomorrow with the release of House Ways and Means budget. And if it feels like we just went through this, we did. Obviously, the budget last year was stalled and was completed in the fall. So we didn't have much time to regroup. But after a careful examination, we did come up with a number, and we'll be requesting an increase of $275,000 to go to $7 million. Now, this will help us continue to deliver important programs and services at a still critical time. We are not through this pandemic, and even when we do get to the other side, many people will still be facing the scar tissue of lingering health problems, lost jobs, lost family members, and the reality of a new world, which still remains to be seen. So maintaining and incrementally building the foundation level of support in this line item is necessary to ensure that Massachusetts maintains its position as a leader in suicide prevention. Now, the legislature will once again have difficult decisions on their hands relative to the thousands of line items within the budget. While the Commonwealth should be in good position with an influx of federal money that everyone has heard about, there's still discussion as to how and where that money can be spent. We've talked about this in the past as well. There are never any guarantees when it comes to the non-discretionary items within the budget, and this includes the suicide prevention line item. That's why it's so important to continue to reach out to your legislators, contacts, and as we talked about, staff, to advocate for this minimal increase during this time. Now, our work won't be done tomorrow after the House releases their budget. We'll need to work through the amendment process in the House if necessary, and then move on to the Senate, where we'll strongly urge senators to once again place a level of urgency on this line item and increase its funding, much like they did last year by taking the lead in their budget recommendations. Now, in addition to the budget line item this year, we are also advocating for policy to move forward, and that is a dedicated revenue stream to fund our call centers. The 988 digits are a dedicated telephone number to reach the National Suicide Hotline. And currently there are 5 call centers in Massachusetts that are part of this Lifeline network. What happens is states can levy a fee on wireless bills. Now, this is similar to the 911 fee that probably nobody even realizes is in existence that's currently in use in Massachusetts. That can be used for these 988 costs. This would include funding for call centers that answer Lifeline calls and other direct service providers. But the legislature needs to pass legislation by July 2022 to codify this policy. Now, there are currently 2 bills that have been filed that would authorize this fee. Senate docket 2065 by Senator Julian Cyr and House docket 2692 by Representative Marjorie Decker. Now, the bills, that's not going to be their final bill number. Just today, the House and the Senate are starting to refer bills to committee, so we'll get potentially a different number by the end of the week. Unlike the annual budget process, the legislative process is a bit more flexible and fluid. The legislature has a more deliberative process when it comes to standalone policy. Currently, the roughly 6,000 bills, as I mentioned, have been filed. Many of them are still waiting official bill numbers and to be referred to committees. At the moment, we do know what committee these bills will be referred to. We will send that information along. The way to look at it is like this. The budget process is a sprint. The legislative process on public policy is a marathon with really no discernible timetables. As such, we will need support as these bills continue to move through the process. And in relation to the 988 fee, that will probably involve several different committees and, of course, debate in both branches. And again, we'll pass along that information as the process moves forward. So thank you for letting me share this information today. And as always, I am happy to answer any questions.
Great, thank you so much, Marty. And again, you'll be getting packets with all of these speaking points and all these different things to help keep you keep it all straight in your head, because that's a lot going on and a lot to process. Thank you, Marty. And I love the analogy of the budget being a sprint and the legislation being a marathon. That's a perfect analogy. So I do have one other guest with us. Before we jump ahead to our action items, I wanted to recognize one more representative who is here with us. Representative Jack Lewis is joining us, and I'd like to introduce Eileen Davis. Eileen is the Vice President of Mass 211 and the Director of Call to Talk, to introduce Jack to us today. Let me go ahead and make sure everyone can unmute themselves. There you go, Eileen. You should be all set now.
There you go. Thanks, sir. Now I'm unmuted. Thanks. This is so exciting. What a great day. Advocacy is just so empowering. I'm really excited to introduce Jack Patrick Lewis. He's our state representative in the Massachusetts House of Representatives, representing our particular area here at Call to Talk, Framingham and Ashland. He's been with us, elected in his office since January of 2017. He's been a real active advocate for us. He's always in the community, lending a hand, smiling, being involved in anything that any agency or program raises their hand and asks for his support on. And as a matter of fact, he just received the state's Suicide Prevention Leadership Award just last month. So we have a lot of pride that he's our representative here. So we're very fortunate to have Jack say a few words on our behalf and the support of our line item.
Thank you so much, Eileen, for that introduction and for really all that you do, and everyone on this call, everything that you all do. I know, Eileen, you asked me to send you some brief introductory remarks, which I don't think I ever did, but those remarks were better than anything I would have put together last night at midnight. So thank you for your flexibility. It is really great to be with you all. I've had a chance to listen into the previous speakers, and just want to add that if this is your first time advocating to a state rep or a state senator or to one of our staff people, share your personal story. That's all great. But be yourself. Nope, don't be worried one bit at all. We have conversations. It's the job we want. It's the job we have. We love talking to people, and we want to hear from you and hearing from our constituents about something that is a shared value, like fighting stigma around mental health and working to prevent suicides, is so much more than a budget line item. But hearing from you and being reminded of how important this legislation is and this line item is really makes all the difference as we decide how the $42 billion or so of the state budget is spent. This is an issue that hits home for probably all of us. It hits home for me, and it's one of the issues that I'm committed to making sure that is a core focus of my work as a legislator. Prior to being elected, I helped to start a nonprofit in the Metro West area, Out Metro West, for LGBTQ middle and high school youth. And as someone who grew up in Ohio, don't tell my constituents, but I grew up in Ohio, lived in Utah and Missouri before coming here. I really had this idea that Massachusetts had figured it all out. It was a place where there was no stigma around mental health, that everyone was accepted and supported, especially around LGBTQ issues, and that all I needed to do was find a job and move cross country. As long as I made it across the border, I would live in this utopia, which of course is never, the reality is never what we imagine it to be. And here in Massachusetts, we must never rest on our laurels, no matter if we're the first or the best at anything. We still need to do a better job of supporting one another. And as someone who came here and had that realization, day one, I immediately was called to support young people who weren't being supported by their community, weren't being supported by their schools in some instances, who hadn't yet been connected to therapists or counselors. And in some instances, had parents that didn't know how to support them or had chosen to do quite the opposite. And it was a statistic that the Metro West Risk Assessment Survey published 10 years ago when we founded this organization that has stayed with me every day since then. Something around 30% of all out LGBTQ high school youth, 30% back, 2011 now, had attempted suicide in the previous year. I thought I misread it. I thought it was contemplated suicide. I thought maybe it was acknowledged depression. No, those numbers were much, much higher. But over 30% of young people who identified as gay or lesbian had attempted suicide in the last year. And so when I went to a meeting every single Monday night and there were 30 young people staring back at me as we circled around and then worked on programming together, knowing that statistically 10 of those 30 had attempted to suicide, and that so many more than the 10 were struggling in ways that I couldn't even begin to imagine. And I personally wish so much that I would have had supports like that growing up, that there wouldn't have been the same stigma in my community around mental health. And now that I'm finally getting the support I want and need, I'm committed to making sure other people receive that same support. So never hesitate to reach out to me or to any of us. This organization and this coalition do such remarkable work. I'm working with Senator Comerford and Representative Natalie Higgins on an additional suicide prevention bill, which would put the national hotline on all student IDs. Happy to continue to make sure that these life-saving numbers are accessible to young people, and that at a time of crisis, no one's Googling on their phone, trying to find a place to turn. But if we don't have those adults already in place, we know at least what number to call or text. But again, thank you so much for the opportunity to speak with you today. And thank you for all that you do and all that you're going to keep doing.
Great, thank you so much, Representative Lewis. That was wonderful. And we will be sure as those bills come up that we rally and we support those bills as well. So thank you for all of your work and for being here today. We appreciate your time. So we're going to go back and talk a little bit of the action items that we can do when we leave here today. We are going to ask you to contact your legislator. If you don't yet know where to find your legislator, we have combined all of your information from your registration, and we already have identified who your legislators will be, and we'll be happy to send you that information. But also Karen is going to put in our chat box a link that you can use to find your representatives directly. We're going to ask you to call them and then follow up with an email to see about setting up a meeting, a time for you to talk with them about these issues that we've raised today. As Marty said, this budget one is a sprint, so we want to get on this a little bit quickly. So we're asking you to reach out to them with your initial contact by the end of this week. You will be provided everything you need in a PDF file from us by email. And when you contact them, you can offer to set up a phone call or a Zoom call. And one thing that we are happy to do for all of our advocates, if this is your first time advocating, or if you just want to have some support and some help, we will be happy to match you with another advocate who can join you in a conference call or who can hop on the Zoom with you. Our advocacy committee is happy to help, our staff, some of our lead volunteers, and even more of our veteran advocates are happy to jump on Zoom calls or conference calls with you. So we're going to ask you to stay in contact with us. We have a wonderful volunteer named Melissa who's going to be reaching out to you to help make sure you're getting those meetings set up and to see if you need any help and you'd like someone to join you. So once you have that meeting, we do have an online feedback form that you can send to us to let us know how it went, who you met with, if there's anything that we need to know, anything that came of the meeting, and of course, gather that contact information for whomever it was you spoke with. As Nancy said, we'd love everyone to become a field advocate today. Help us push to that 100,000 field advocates for AFSP through the link that's in the chat box. And of course, our amazing partners, the Massachusetts Coalition for Suicide Prevention, a next step would be for you to join them as well. And we will put that link in our chat box as well. So what you will be receiving from us is your packet, our participant packet. It will have the Speaking Out About Suicide Safely flyer, your issues brief, which is this document you see here on the screen, which will help us really outline the different bills that we're looking for support for and gives you all of that information about the budget line item as well. We have a great document called Advocacy Tips and Tricks, and then your personal vignette that Jess walked you through earlier. The second thing you'll get in your email is a legislative packet. This is what you are going to email to your legislator in advance of your meeting. It will have the same issues brief, some supporting documents, a wonderful letter that supports our budget ask, and some information about the 988 legislation. And to that, you want to attach your personal vignette. We also have great online resources for you, again, that Find My Legislator if you need support with that, and then our advocacy website as well. So this is what we're looking to do as we head out from here today. If anyone has any further questions, we'll be, of course, CCing everyone on these emails, myself from AFSP, Jen, who you met earlier from the MCSP, and Marty is also always available with specific questions regarding our budget funding line item or any legislative issues. So we do have a few minutes if we'd like to have some Q&A, if anyone wanted to share some thoughts. And then we have our Advocacy 101 for anyone who is a new advocate or who wants to be a refresher on how the process works and how to advocate. We also do have one more thank you message. I'd like to introduce our AFSP board member, Dr. Lindsay Nunes, who is a constituent of Senator John Velis, to introduce him today.
Great, thanks, Heather. Hi, everyone. I'm Lindsay. Senator John Velis represents 2nd Hampden and Hampshire District in the Massachusetts State Senate, which includes his hometown of Westfield and 10 other cities and towns in Western Mass. Prior to his time in the Senate, he was a state rep for the city of Westfield in the House of Representatives. Senator Velis is currently the vice chair of the Joint Committee on Mental Health, Substance Use, and Recovery in the state legislature. Senator Velis is a true friend to AFSP in Western Mass and has joined and spoken at our Greater Springfield Out of the Darkness Walk and local campus walks. While there, he wears silver beads to support suicide prevention among first responders and the military during our honor bead ceremony. His unwavering commitment ensuring that all people of Massachusetts have the support, resources, and opportunities to live healthy and meaningful lives is demonstrated day in and day out through his tireless efforts. Whether it's an email, a phone call, a meeting, a grand opening, a special event, truly anything, you can always count on Senator Velis. We're so grateful to have him in our corner joining the fight against suicide in Massachusetts. Thank you.
Hey everybody, this is John Velis, State Senator for the 2nd Hampden and Hampshire District. First and foremost, I want to thank you for your efforts. There is no cause more important than the one you're meeting for here today. And I really just want to say, as I'm now the Vice Chairman of the Mental Health and Substance Use and Recovery Committee, I will do whatever I can to help you in your efforts. The past year with COVID-19 has exacerbated exactly what you folks are doing by amounts that are just really tough to quantify. Thank you. Thank you for taking the time to meet here today. Thank you for advocating, because I have to tell you, we need your efforts now more than ever. What a great cause. View me as an ally. When we get back into the State House, please come and see me, and just know that I will do whatever I can, because this is a cause, suicide, mental health, that we need more people advocating for. So thank you, and I'm looking forward to seeing you all in person. Have a great day.
We're very thankful for all of our senators. I think we all needed
Hey
that.
everybody, this is John
that nice little
Velis.
thank you from Senator Velis. So thank you to all of you. Thank you to all of our partners. We do have some questions in the chat box. I am going to ask to put either Nancy or Jess on the spot, whoever's feeling brave and wants to unmute themselves first. We had a great question from Kelly about what is a normal or average meeting with your representative look like? How long does it last? How does it sort of flow? How do you wrap it up? So can we give a little bit of insight? Nancy, I see you first, so you're up. On what that could look like for Kelly?
Great question. And in person, I'll briefly talk about both versions. In person, call, make an appointment. Sometimes it's with staff, sometimes it's with the senator or representative. I usually say in advance, I only need 10 or 15 minutes of time. I'm going to have some information about our request, and then go in, hopefully dragging somebody with me. But if not, staff is usually always welcoming. And if they're not, you should tell us so we can fix that. I always start by saying I'm a loss survivor. I lost my brother in 1992. And after that, I found the suicide prevention movement. And that has become my family as well as my other siblings. And I'm here today because, and then I tell the story of what we need to do and why. We don't spend enough on suicide prevention. We need to have better programs. We need to reach people more at risk. We need to be more diverse in our outreach. And then, talk about what the budget means. Yeah, we have a lower rate here in Massachusetts, but there's still about 500 people who die by suicide each year in our state. So, I give myself a few facts that if I get flustered, I can, roll out. But in the meantime, once I start telling my story, there's no stopping me most of the time. And by phone, pretty similar. You can email to set up an appointment, or you can call the office. Most offices are remote, so sometimes an email is going to be better. Again, say why you want to talk to the staff or the legislator, that it'll only take 10 or 15 minutes. Usually, I actually have to tell you that once in Washington, Joe Kennedy, my congressman, spent 25 minutes with us taking notes on what we had to say. So there are people who want to hear, like Jack Lewis, who really want to hear your story and everything. But the average staffer is going to say, you're going to hand the packet over, or you're going to email the packet, and you're going to talk again about why it's so important. Today we heard from 3 leading elected officials how important this issue is, perhaps the most important issue of the session. So the budget session. So use those lines, tell those stories, and know that all of us are here to back you up. If you get asked a question you don't know the answer to, say, "Gosh, I don't know that answer, but I'm going to get you that answer." And you reach out to one of us and we send that reply. Or we ask Marty to stop by that office and explain to that elected official or staff person what's important and why that support is so needed. I don't know, Jess or Marty, did I miss anything that you would advise?
No, that basically is. I mean, I think in terms of timing, 15 to 20 minutes. My former boss, when I was at Ways and Means, used to tell people that came in, if you can't tell me what you need within 20 minutes, you're doing it wrong. So, 15 to 20 minutes typically. The other thing I would add, though, and believe me, this goes a long way, and unfortunately, it's not of common practice, just a simple thank you note after the meeting. A couple of days later, it's a great follow-up, which can lead to additional conversation. But B, especially if you're a staff member, you never get that type of recognition. And whoever sends you that thank you, you're going to remember their name. And it just seems like something so small, but it does go a long way, especially with staff and then even with the legislators. So anytime you can follow up and just give a note of thanks, believe me, it is appreciated, and it'll go a long way to help your request.
Great. Thank you both, Nancy and Marty, for jumping in on that. One other question we had is if we'll be giving contact information for your legislators. Of course, we will be helping with that. And someone mentioned they sometimes have difficulty reaching out to their representatives. So please let us know. We're happy to help. We are very used to banging on doors, and we will help bang on those doors for you. One of the things you'll also be receiving is a template email that you can use and personalize. So it'll hit on all of these top points that Nancy and Marty are making for us. Well, thank you everyone again, and thank you for all of our partners at the Massachusetts Coalition for Suicide Prevention. For those of you who are new to advocacy and would like a refresher, Karen is going to lead us in our Advocacy 101 at this point. For those of you who are signing off, please keep an eye out for that email. We'll be sending you all of your materials, and you'll be hearing from each of us to follow up and make sure you're having success connecting with your elected officials. Thank you so much. And now I'd like to welcome Karen Carrera to lead us in the last portion of our day.
Good afternoon, everyone. Thank you, Heather. Thank you to everyone who's participated so far today. What a great, inspiring hour we've had. A takeaway from the last hour is legislators are people too, and they care, and they're working on behalf of us as their constituents and what we care for as well. And so bringing that human part to this legislation process is really a critical thing that we can all do. So let's talk a little bit about lawmaking basics. It is a daunting thought, as Elena said earlier, and this is really a condensed version of what we can explain to you, what happens here in Massachusetts and across the United States. Where does legislation come from? So first, it comes from legislators and what they believe in their personal experiences. So they're, it's a call to work on behalf of the people, and they usually are charged with making a change in some sort of way. So finding those folks who support the issues that you are close to, and we've heard from 3 today, is a key to closer to getting your voice heard and making some change. It comes from us, as I just said, and in conjunction with AFSP and the Mass Coalition here in Massachusetts, and they work directly with legislatures and other leading mental health organizations to write policy and provide resources to support future legislation. How does the bill become a law? Well, it starts with the legislature and the idea for a bill and what they'd like to write and produce. They introduce it and it is assigned to the relevant committee. For example, if we work with a senator to introduce a bill to have all teachers trained in suicide prevention, that's a good one. That bill will go to the Senate Education Committee. The committee then has the opportunity to review and edit the bill before sending it back to the floor for a vote. If the bill is voted on favorably, it will go to the other house. Our teacher training bill, for example, if voted on favorably by the full Senate, would be moved to the House and go through the same committee review and floor voting process. So there is a little bit of back and forth. It does take a little bit of time, but there is due process with all of these things we're talking about today. Only when a bill has been voted on favorably in both houses can it go to the governor and be signed into law. The governor also has the option to veto the bill and send it back to the House and Senate for revision. So here's some helpful websites because it really is such a process. How to find a bill, where bills are, how to track a bill, identifying what legislators support which bills, what offices support what committees support what, and to talk about it here, we're just giving you the basic overview. You can find your Mass legislator at masslegislator.gov. And congress.gov is also a great place to go. Search for federal and legislation by bill number or keyword. We provided those things in our handout sheets for you today, what you'll get in your packet. So when you're looking to see the exact language in the bills that we're supporting, all you need to do is share that bill number or the keyword. You can also advocate on the federal level and can find all that information at congress.gov. Keep in mind that members of Congress also have district offices in their state, so you don't need to travel. You don't need to travel to DC to connect with them in person. And luckily, a blessing in disguise of this very upside down year has been our ability to reach out to people across the country and across the nation, across the world with the click of a button. So communication is a little bit easier these days. Advocacy resources. If you're interested in learning more about the policy and specific policy areas that AFSP works on at both the federal and state level, I encourage everyone to look at the public policy pages found at afsp.org/priorities. This is a wealth of resources. We have fantastic people working in national and at our DC office who really know the ins and outs, upside downs, backs and forwards of all the things that are being put forth nationally and from state to state. So Massachusetts has public policy folks in the office dedicated to researching, tracking, getting information for all of the bills that are being introduced and put forward in Massachusetts. And that is nested within the national office as well. It's such a great resource, and I encourage you to visit afsp.org/advocacy resources. You'll find a sample of meeting videos there if you'd like to get a little tip of how things go, and previous webinars on top policy priorities. AFSP advocates receive emails from the Public Policy Office on issues that need their support. This is fantastic. You register as a field advocate and you are sent the template, the ask, all of the information that you need. You have the option of customizing language in a paragraph, putting your story within this ask directly sent to, already done for you. I think Heather and a couple others on the last one we did, it took under 2 minutes to really customize, sign your name and get it forward and move it to where you really wanted it to go. It's a fantastic thing. I encourage you all to visit the Public Policy Office information on our website. And then we have the AFSP Action Center that you can go to. Those are additional resources. And then, what's our next slide? Heather, there we go. Be a resource for lawmakers. There are lots of ways to stay connected with your lawmakers on the state and federal level throughout the year. And so I and everyone on this call encourage you to visit your state legislative website, visit the websites of your personal legislators and sign up for their newsletters. That's a great thing to do too. You can follow what they're doing and where things are in real time, how they're happening. Follow their social media pages. And find an opportunity to meet with them in their district or capital office. If you have any questions now or in the future, again, this is a lot of information and a basic overview. Please feel free to reach out to anyone at AFSP and the Public Policy Office. You can email them at advocacy@afsp.org or contact any of the folks who are on this call today, and we'd be happy to help you out. Thank you very much for your time and your attention.